Hello and welcome to the Bay Area Medical Center's informational video on labor epidurals. Labor epidurals are used for pain control during childbirth. In this video, I will talk about what an epidural is, how it's used, and help you understand what will happen to you during the procedure. I will also discuss some of the risks of an epidural. Now, on with the presentation. What is a labor epidural? An epidural is a specific medical procedure used to reduce labor pains during childbirth. A small thin tube called a catheter is placed in the epidural space of the lumbar region of the patient's spine. Pain medicine is then given through the epidural catheter and flows onto the nerves. This allows the patient to experience some pain relief. What are the goals? The goals of a labor epidural are to allow for pain control during the labor. Most patients are not completely pain-free, but the worst pain is often reduced. Patients are asked about their pain level using a score from 1 to 10, with 3 being mild, 5 as moderate, and 9 being severe pain. A pain score from 8 to 10 out of 10 can be reduced to a 4 to 5 out of 10, and possibly even lower. You can and often will still have pain signals. The patient's muscles should still be able to work to deliver the baby. So how does it work? The catheter is placed in the epidural space. This anatomy will be shown to you in a drawing later. Numbing medicine, also known as local anesthetic, combined with a small dose of pain medicine, an opioid, is given near the patient's nerves that sends the body pain signals. This two-medicine combination works better together than when used alone. The benefit of an epidural is that they can provide very good analgesia or pain control with fewer side effects than IV drugs or drugs given by other routes such as a spinal. The benefits are the majority of patients have very good pain control. It does not delay labor progress, and it does not increase the risk of having a C-section. Patients are able to rest and save their strength for when it's time to push. They're also able to move their arms and legs. An epidural has fewer side effects than other pain control methods. The alternatives to an epidural are some holistic techniques. These include natural childbirth, the Lamaze technique, which is used to control awareness and boost confidence, for example through breathing. These techniques can be reviewed at www.lamaze.org. Other medical methods for pain control include intravenous narcotics, such as Nubane, or intrathecal, which means in the spinal fluid. You can use opioids, such as morphine. Any method has strengths, weaknesses, and possible side effects. So what are the risks of an epidural? Well, an epidural may fail to work. The patient might need additional epidural procedures or other procedures. Patients can have a bad reaction to the medicine, including fever, itching, low blood pressure, trouble breathing, inhaling stomach contents known as aspiration, and others. Also, there's the possibility of bleeding, bruising, infection, soreness at the puncture site. There is a risk of nerve damage. Also, a post-dural puncture headache or spinal headache can happen after a tear in the dura mater, which is the protective covering outside of the spinal cord and cerebrospinal fluid. Patients can have medicine go somewhere instead of the epidural space, causing a spinal, a massive epidural, medicine in the bloodstream, or medicine absorbed by the baby, and others. An epidural may have patchy areas when local anesthetic doesn't get to every nerve. The obstetric nurse can help with this by repositioning the patient. Also, pushing the button on the epidural pump may help by giving more medicine. For those patients who experience a spinal headache, know that we treat this conservatively. Drink fluids and take analgesics allowed by the obstetrician. Drink caffeinated beverages such as coffee, tea, or Mountain Dew. Try to rest for 2 to 3 days. If this doesn't work, then we can do an invasive treatment called an epidural blood patch. While this may help reduce the headache, it can also cause a spinal headache or make one that you already have even worse. What are the complication rates of an epidural? Something called an epidural hematoma, or a blood blister, can cause permanent paralysis. This is seen in 6 out of 1 million patients. An epidural infection can occur in 7 out of 1 million patients. Persistent neurologic injury can be seen in 4 out of 1 million patients. Neurologic injury that lasts less than 1 or 2 years can be seen in 1 out of 5,000 patients. The spinal headache or post-dural puncture headache is seen in 1 to 2 out of 200 patients. A backache is seen in 20 out of 100 patients. And patients are 17 times more likely to have urinary retention and to need a urinary catheter placed. Let's go over the anatomy. From the skin to the epidural space, these are the anatomic components. The skin, the subcutaneous fat, the supraspinous ligament, the interspinous ligament, the ligamentum flavum, and then the epidural space. The epidural space is not a real space. It has fat, blood vessels, and nerves contained within it. The spinal cord is bathed in cerebrospinal fluid and is covered by the dura mater. The Latin translation means tough mother. The epidural means something outside or next to the dura mater. Here's a diagram of the epidural space. Going from top to bottom, reading the text, you can see that the epidural space is shaded by this gray oval area. Then we see the ligamentum flavum, and the interspinous ligament, and the supraspinous ligament. The green arrow shows the path to the epidural space through the supraspinous ligament, interspinous ligament, and ligamentum flavum outside of the dura mater. This is a photo of the epidural procedure tray and catheter. On the left, you see the catheter, which is the thin tube that delivers the medicine. The black marks are centimeter markings that show how deep the epidural catheter is, allowing the anesthesiologist to know that it's in the correct space. To the right, you see the various syringes and needles used to perform the procedure. Often patients ask, when should I get an epidural? Epidurals are given when the patient requests one. Typically, it is placed when the pain is at a moderate level, such as 3 to 5 out of 10. It may reduce the length of labor when given earlier in labor rather than later. If requested too far along in the labor, an epidural may not make sense to get. The risk outweighs the benefit, since the baby's delivery is going to happen very quickly. What will happen before the procedure? For the sterile epidural procedure, patients will typically be sitting up. People other than the patient and medical personnel are asked to leave the room. The anesthesiologist and the obstetric nurse will help patients during this medical procedure. We will ask you to push out your lower back. This is known as your lumbar spine. We also want you to drop your chin to your chest and let your shoulders relax toward the floor. Here's a picture showing the positioning for the epidural placement. For the epidural procedure, the skin is prepared with germicidal solution and a sterile drape is applied to the back. Local anesthetic is injected under the skin and into the ligaments. The epidural needle is inserted to reach the epidural space. Positioning is very important to help this happen. A small catheter is placed to deliver the medicine and the needle is removed. A test dose is given to ensure the catheter tip is in the correct location and not delivering medicine into the bloodstream or causing spinal anesthesia. The epidural catheter is then secured with dressings and tape. An epidural pump is connected, and the pump is there giving the pain medicine continuously, injecting it through the epidural catheter onto the nerves. Patients can also push the button connected to the pump if they need more pain medicine. Thank you for listening to this presentation. If you have any questions, please ask your obstetrician or the nurse that's helping you view this video. Disclaimers. Please discuss the risks, benefits, and alternative therapies or treatments with your anesthesia provider before making any anesthesia-related healthcare decisions. An epidural for pain control during labor is an elective procedure and is not necessary nor a requirement for typical labor and delivery. This presentation is not meant to be used or relied upon for medical decision-making or guidance about any specific condition. It is not meant to take the place of any healthcare service you may need. It is meant to be used as a generic informational resource only. There are no guarantees expressed, and it does not take every medical situation into account. Bay Area Medical Center Anesthesia Service and personnel disclaims any responsibility and has no liability for damages, loss, or injury suffered as part of your reliance on the information provided by this presentation. Bay Area Medical Center disclaims all warranties with regard to the information included in this media presentation. BAMC and its affiliates are in no event directly or indirectly responsible for any damages resulting in personal injury, property damage, loss of work or use, or loss of data or profits from negligence or any other action arising from the use of the information obtained from this media presentation.